Hi, welcome to the lecture on Psychiatric Emergencies. After you complete this chapter and related coursework, you will be able to recognize behaviors that pose a risk to the EMT, the patient, or others, and the basic principles of the mental health system. Additionally, you will have the knowledge and skills to successfully assess and manage patients who are suffering from a psychiatric emergency within the legal parameters of your scope of practice. Regarding the National EMS Education Standard Competencies for Medicine, as stated before, an EMT at the completion of EMT training will be able to apply fundamental knowledge to provide basic emergency care and transportation based on your assessment findings for patients who are acutely ill. Specifically related to psychiatric emergencies, the EMT will be able to recognize behaviors that pose a risk to themselves, their patients, or others, and will understand the basic principles in the mental health system. You will also be able to assess and manage patients who are experiencing acute psychosis, who are suicidal or risk for suicide, and who are experiencing agitated delirium. EMTs often deal with patients undergoing a psychological or behavioral crisis. The crisis may be the result of the emergency situation itself, a mental illness, mind-altering substances, stress, and there can be many other causes as well. Myth versus reality. We all develop some symptoms of mental illness at some point in life. This does not mean that everyone develops a mental illness. Perfectly healthy people may have some symptoms and signs of mental illness from time to time. You should not jump to conclusions concerning yourself or your patient. The most common misconception about mental illness is that if you are feeling bad or depressed, you must be sick. There are many justifiable reasons for feeling depressed, things like divorce, job loss, or the loss of a relative or friend by death. Many people believe that all individuals' mental health disorders are dangerous, violent, or otherwise unmanageable. Only a small percentage of people with mental health problems fall into these categories. However, as an EMT, you may be exposed to a higher proportion of violent patients. Although you cannot determine what has caused a patient's crises, you may be able to predict whether they will become violent. Behavior is what you can see of a person's response to the environment, his or her actions. Most of the time, people respond to the environment in reasonable ways. There are times, however, when stress is so great that the normal ways of adjusting do not work. A person's behavior is likely to change, even if only temporarily. The new behavior may not be appropriate or normal. Behavioral crisis is any reaction to events that interferes with the activities of daily living or has become unacceptable to the patient, family, or community. If the interruption of daily routine tends to recur on a regular basis, the behavior is also considered a mental health problem. It is then a pattern rather than an isolated incident. Usually, if an abnormal or disturbing pattern of behavior lasts for at least a month, it is a matter of concern. Chronic depression, a persistent feeling of sadness and despair, may be a symptom of a mental or physical disorder. When a psychiatric emergency arises, the patient may show agitation or violence and may become a threat to themselves or others. Disruption can take many forms. Not all involve violence, nor are they all psychiatric emergencies. According to the National Institute of Mental Health, at one time or another, 1 in 5 Americans has some type of psychiatric disorder. A psychiatric disorder is an illness with psychological or behavioral symptoms that may result in impaired function. The U.S. mental health system provides many levels of assistance to people with psychological problems. These take many forms, such as professional counselors are available for marital conflict and parenting issues. More serious issues, such as clinical depression, are often handled by a psychologist. Some of the most severe psychological conditions, like schizophrenia and bipolar disorder, require psychiatrists. Most problems can be handled through outpatient visits. However, some people will require hospitalization in specialized psychiatric units. As an EMT, you are not responsible for diagnosing the underlying cause of a behavioral crisis or psychiatric emergency. You should know the 2 basic categories of diagnosis a physician will use, both organic or physical and functional or psychological. Organic brain syndrome is a temporary or permanent dysfunction of the brain caused by a disturbance in the physical or physiologic functioning of the brain tissue. Some of the causes include sudden illness, recent head trauma, seizure disorders, drug and alcohol intoxication, overdose, or withdrawal, and as well as diseases of the brain such as Alzheimer's and meningitis. Altered mental status can arise from things like a low level of blood glucose, a lack of oxygen, inadequate blood flow to the brain, and excessive heat or cold. A functional disorder is one in which the abnormal operation of an organ cannot be traced to an obvious change in the actual structure or physiology of the organ or organ system. Some of the examples of functional disorders include schizophrenia, anxiety conditions, and depression. They may have either a chemical or a physical cause, but it is not obvious or well understood.
Most patients that you treat will not exhibit violent behavior, but a small percentage of patients do pose a threat to you. Eventually, you may have to deal with such a patient. By following proper procedures, you have a better chance of restraining the patient without injury to the patient or to any of the emergency response team. Use appropriate body substance isolation precautions prior to beginning patient care. As soon as the danger has been identified, call the police for assistance.
Just gonna back off. Just take it easy. Alright?
Stay away.
Okay. Stay away.
Remove unnecessary personnel from the scene and maintain a safe distance.
We're good. Pause. I need you to call for the police. I need an officer up here right away with some assistance. Sure.
Medic 192 to 62, need police assistance.
While negotiations are led by one member of the team, the other members should formulate a plan for restraining the patient. This plan should include who will be responsible for controlling which part of the patient's body. It is best for 3 to 4 people to attempt the restraint. As you plan your actions, assign people to the following sites. A person should be assigned to grab the upper and lower part of each arm. Another person should wrap his arms around the patient's legs from behind. And if available, a 4th person should approach from behind and grab the patient's head. Using a calm voice, talk to the patient and attempt to calm the patient down. To avoid confusion, only one responder should communicate with the patient. Be prepared to spend time talking to your patient. As long as the patient keeps talking and is not imposing an immediate threat, time is on your side. If you feel you have exhausted all negotiations, it's time to take action. Assume the proper position to subdue the patient. The negotiator should continue to talk to the patient and attempt to gain the patient's compliance. Remember the following rules as you approach and restrain the patient. Act fast and act together to control the patient. Do not give the patient an opportunity to develop a counterplan. Restrain each arm by the upper arm and controlling the lower arms. Working in unison, put the patient in a seated position on a cot as soon as possible. Apply straps to the patient's chest, hips, and thighs. Wrist restraints should be applied and tied to the sides of the cot. Ankle restraints may be applied if necessary. Be sure the restraints do not cut off the distal circulation. Once the patient is secured to the cot, perform the necessary physical exam. This may be as simple as identifying that the patient continues to breathe and is conscious.
So as you saw in the video, we use all of our regular EMT skills in a behavioral crisis. However, there are some other management techniques that come into play, and you've seen those. We're going to go over them in the next slide. You should follow the general guidelines listed in Table 20-1 in order to ensure your safety at the scene of a behavioral crisis or psychiatric emergency. You need to be prepared to spend extra time on this scene. You need to have a definite plan of action, and you should be very calm in your identification of yourself and your team. Be direct with your patient, perform a scene assessment, stay with the patient, encourage them to make purposeful movements, express an interest in their story, but do not get too close to the patient and avoid fighting with them. You need to be honest and reassuring, and you do not judge. The steps of patient assessment in psychiatric emergencies are the same as in any other emergency. Scene safety and size up, primary assessment, history taking, perform your secondary assessment, and then reassess your patient. Regarding scene size up, scene safety by far here is a concern. You need to consider the scene safety and the patient's response to the environment. Is the situation unduly dangerous to you and your partner? Do you need immediate law enforcement backup? Does the patient's behavior seem typical or normal for the circumstances? Are there legal issues involved? Make a decision regarding the mechanism of injury or nature of the illness. You need to determine whether this is a result of an injury or an illness. Form your general impression. Begin your assessment from the doorway or from a distance. How does your patient appear? Begin with an introduction of who you are and let the patient know that you are there to offer them help. Perform a rapid scan. Observe the patient closely. Use AVPU to check for alertness. Establish a rapport with the patient, and then focus your primary assessment in assessing and treating life threats. Assess the airway to make sure it is patent and adequate, especially if your patient is in physical distress. Evaluate their breathing. Check their circulation by assessing pulse rate, quality, and rhythm, and obtain both systolic and diastolic blood pressures when possible. Evaluate for the presence of shock and bleeding, and assess the patient's perfusion by evaluating skin color, temperature, and condition. Make your transport decision. Unless your patient is unstable from a medical problem or trauma, prepare to spend time at the scene with your patient. Depending on your local protocol, there may be a specific facility to which patients with mental problems are transported. Investigate your chief complaint. Consider the three major areas of possible contributors. Is the patient's central nervous system properly functioning? Are hallucinogens or alcohol a factor? Are psychogenic circumstances, symptoms, or illness caused by mental other than physical factors involved? Obtain your sample history. You may be able to elicit information not available to the hospital staff. Ask about previous episodes, treatments, and hospitalizations, and medications related to behavioral problems. Some good questions to ask are shown here and in your text on Table 20-1. In a geriatric patient, you need to consider Alzheimer's disease and dementia as possible causes of abnormal behavior. It is essential to obtain information from relatives, friends, or extended care facility staff. Your assessment of the situation has two primary goals: recognizing major life threats and reducing the stress of the situation as much as possible. You should use reflective listening techniques, which is a technique used by many mental health professionals to gain insight into a patient's thinking. Repeat in question form what the patient has said, and this will encourage the patient to expand on the thoughts. Perform a secondary assessment. In the physical examination, if your patient is unconscious, begin with a full body scan to look for the reason for unresponsiveness. When examining a patient with a behavioral emergency, remember to check for track marks indicating drug abuse and for signs of self-mutilation. Avoid touching the patient without permission, and a conscious patient may not respond to all of your questions. You can tell a lot about a patient's emotional state from facial expressions, heart rate, and respirations. Check vital signs. Obtain your vital signs. When doing so will not cause the patient further emotional distress. Make every effort to assess blood pressure, pulse, respiration, skin, and pupils. Monitoring devices may be used when they will not cause the patient's distress to elevate. Assess the patient's first blood pressure with a blood pressure cuff and a stethoscope. And then a pulse oximetry device can be used to assess the patient's perfusion status. Never let your guard down. Many patients experiencing a behavioral crisis may act spontaneously, and you need to be prepared to intervene quickly. If restraints are necessary, reassess and document the patient's respirations as well as pulse and motor sensory function in all restrained extremities every 5 minutes. When available, you should have additional personnel accompany you in the back of the ambulance during transport. Your heart may go out to the emotionally distressed patient. However, there is often little you can do during the short time you will be treating them. Your job is to diffuse and control the situation and safely transport the patient to the hospital, and you need to intervene only as much as it takes to accomplish these tasks. Try to give the receiving hospital advance warning that a patient is experiencing a psychiatric emergency and you are bringing them in. Many hospitals require extra preparation to ensure that appropriate staff and rooms are available. Report whether restraints will be required when the patient arrives at the hospital, and you need to document thoroughly and carefully. Yours may be the only documentation about the patient's distress, and psychiatric emergencies are fraught with legal dangers for the EMS crew. If restraints are used, you need to say what types and why they were used. Psychosis is a state of delusion in which the person is out of touch with reality. Affected people live in their own reality of ideas and feelings. Some of the causes of psychosis include mind-altering substances, intense stress, delusional disorders, and schizophrenia. Some episodes last for brief periods, while others may last a lifetime. Schizophrenia is a complex disorder that is not easily defined or easily treated. The typical onset occurs during early adulthood, with symptoms becoming more prominent over time. Influences thought to contribute to the disorder include brain damage, genetics, and psychological and social influences. Individuals with schizophrenia experience symptoms including delusions, hallucinations, a lack of interest in pleasure, and erratic speech. Guidelines for the EMT for dealing with a psychotic patient. First of all, determine if the situation is dangerous. You need to identify yourself very clearly and make sure that the patient knows you're there to help. Be calm, direct, and straightforward, and maintain an emotional distance. Do not argue with the patient. Explain to them what you would like to do, and involve individuals that the patient trusts, such as family or friends, to gain cooperation of your patient. Depression is the most significant factor that contributes to suicide. It is a common misconception that people who threaten suicide never commit it. Suicide is a cry for help, and threatening suicide is an indication that someone is in a crisis that he or she cannot handle alone, and immediate intervention is necessary. Table 20-3 in your text and on this slide gives you some risk factors for suicide. Again, another resource as a study guide for you. Be alert to the warning signs of suicide. Does the patient have an air of tearfulness, sadness, deep despair, or hopelessness that suggests depression? Does the patient avoid eye contact, speak slowly or haltingly, and project a sense of vacancy? Does the patient seem unable to talk about the future? Is there any suggestion of suicide? And does the patient have any specific plans relating to death? Consider the following additional risk factors for suicide. Are there any unsafe objects in the patient's hands or nearby? Is the environment unsafe? Is there evidence of self-destructive behavior? Is there an imminent threat to the patient or to others? Is there an underlying medical condition? Are there cultural or religious beliefs promoting suicide? Has there been any trauma? Remember, suicidal patients may also be homicidal. If you believe you are in danger, obtain assistance from law enforcement authorities. The most important service you can provide for a suicidal patient is compassionate transport to a medical facility where the patient can receive proper treatment. Agitated delirium. Delirium is a condition of impairment in cognitive function that can present with disorientation, hallucinations, or delusions. Agitation is characterized by restless and irregular physical activity. Although patients experiencing delirium are generally not dangerous, if they exhibit agitated behavior, they may strike out irrationally. In such cases, your personal safety must be considered. Symptoms may include hyperactive, irrational behavior, inattentiveness, vivid hallucinations, hypertension, tachycardia, diaphoresis, and dilated pupils. If you believe you can safely approach the patient, you should be calm, supportive, and empathetic. You need to be an active listener by nodding and indicating an understanding and limiting your interruptions of the patient's comments. Approach the patient slowly and purposefully and respect the patient's territory. Limit physical contact as much as possible and do not leave the patient unattended. You should use careful interviewing to assess the patient's cognitive functioning. Try to indirectly determine the patient's orientation, memory, concentration, and judgment. And you should pay particular attention to the patient's ability to communicate clearly and make notes on the patient's apparent mood. Pay attention to the patient's appearance, dress, and personal hygiene. If you determine the patient requires restraint because he or she is a threat to himself or herself or to others, make sure you have adequate, well-trained personnel available to help you before you approach the patient. If the patient appears to be experiencing an overdose, take all medication bottles or illegal substances with you to the hospital. The patient should be transported to a hospital that also has psychiatric facilities, and whenever possible, you should refrain from using lights and sirens. Medico-legal considerations of psychiatric emergencies. The medico-legal considerations are more complicated with a patient undergoing a behavioral crisis or a psychiatric emergency. Legal problems are reduced when the patient consents to care, and gaining your patient's confidence is crucial. Once you have determined that a patient has impaired mental capacity, you must decide whether he or she requires immediate emergency medical care. A patient in a mentally unstable condition may resist your attempt to provide care, and you should never leave the patient on their own. Doing so may result in harm to the patient and expose you to a civil action for abandonment or negligence. You should request law enforcement personnel to handle the patient. Implied consent is assumed with a patient who is not mentally competent to grant consent. Consent matters are not always clear-cut in psychiatric emergencies, and if you are not sure, you should request the assistance of law enforcement personnel. The EMT has limited legal authority to require or force a patient to undergo emergency medical care when there is no evidence of a life-threatening condition. You should be familiar with your local and state laws regarding these situations. And remember, a competent adult has the right to refuse treatment even if life-saving care is involved. In psychiatric cases, however, a court of law would probably consider your actions in providing life-saving care to be appropriate. A patient who is in any way impaired may not be considered competent to refuse treatment and transport. You should always maintain a pessimistic attitude toward your patient's condition. Assume the worst and hope for the best. Err on the side of treatment and transport. Restraints. Ordinarily, restraint of a person must be ordered by a physician, a court, or a law enforcement authority. If you restrain a person without authority in a non-emergency situation, you expose yourself to a possible lawsuit and to personal danger. Legal actions against you can involve charges of assault, battery, false imprisonment, and violation of civil rights. You may use restraints only to protect yourself or others from bodily harm or to prevent the patient from causing injury to himself or herself. You may use only reasonable force as necessary to control your patient. Always consult medical control and contact law enforcement personnel for help before you restrain a patient. Law enforcement personnel can provide physical backup in managing the patient and serve as the necessary witness and legal authority. Always try to transport a disturbed patient without restraints if at all possible. Be aware of standard precautions, and if the patient is spitting, place a surgical mask over his or her mouth. You should use at least 4 people to carry out restraint, each being responsible for one extremity. Discuss the plan of action ahead of time and stay out of the patient's range of motion. When you are subduing a disturbed patient, you need to use minimum force. Avoid acts of physical force that may cause injury. The level of force will vary depending on the following things: the degree of force that is necessary to keep the patient from causing injury to himself, herself, or others, the patient's sex, size, strength, and mental status, including the possibility of drug-induced states, and the type of abnormal behavior the patient may be exhibiting. Secure the patient's extremities with approved equipment. Treat the patient with dignity and respect at all times, and monitor them for vomiting, airway obstruction, and cardiovascular stability. Never place your patient face down, and document the reason for restraint and the technique that was used. The potentially violent patient. Violent patients make up only a small percentage of behavioral or psychiatric patients. However, The potential for violence should always be an important consideration for you as an EMT. Assess the level of danger based on the following risk factors. The history. Has the patient previously exhibited hostile, overly aggressive, or violent behavior? Posturing. How is the patient sitting or standing? Are they tense, rigid, or sitting on the edge of their seat? The scene. Is the patient holding or near potentially lethal objects such as knives, guns, glass, pokers, or bats? Vocal activity. What type of speech is the patient using? Are they being loud, obscene, erratic, or bizarre? These are the speech patterns that usually indicate emotional distress. What is their physical activity? The motor activity of a person undergoing a psychiatric crisis may be the most telling factor of all. A patient requiring careful watching is one who has tense muscles, clenched fists, or glaring eyes. They may be pacing, they cannot sit still, and they are fiercely protecting their personal space. Some other factors to consider include poor impulse control, a history of truancy, fighting, and uncontrollable temper, tattoos, especially those with gang identification, prison tattoos, or statements such as born to kill or born to lose, substance abuse, depression, which accounts for about 20% of violent attacks, and functional disorders. In summary, a behavioral crisis is any reaction to events that interferes with the activities of daily living or has become unacceptable to the patient, the family, or the community. During a psychiatric emergency, a patient may show agitation or violence or become a threat to himself, herself, or others. This is more serious than the more typical behavior crisis that causes inappropriate behavior, such as interference with activities of daily living or bizarre behaviors. According to the National Institute of Mental Health, at one time or another, 1 in 5 Americans had some type of psychiatric disorder, an illness with psychological or behavioral problems that may result in impaired function. Psychiatric disorders have many possible underlying causes, including social or situational stress, psychiatric disorders, physical illnesses, chemical problems, or biologic disturbances. Sometimes the underlying causes of psychiatric disorders can be compounded by noncompliance with prescription medication regimens. As an EMT, you are not responsible for diagnosing the underlying cause of a behavioral crisis or psychiatric emergency. Your job is to diffuse and control the situation and safely transport your patient to the hospital, intervening only as much as it takes to accomplish these tasks. Be caring and be careful. To the patient who is experiencing a psychotic episode, the line between reality and fantasy is blurred. Remember, the threat of suicide requires immediate intervention. Depression is the most significant risk factor for suicide. A patient who is experiencing delirium, they are generally not dangerous, but if they exhibit agitated behavior, they may strike out irrationally. One of the most important factors to consider in these cases is your personal safety. A patient in a mentally unstable condition may resist your attempts to provide care. In such situations, request the law enforcement personnel handle the patient. People who are violent or dangerous must be taken into custody by the police before emergency care can be rendered. Always consult medical control and contact law enforcement personnel for help before restraining a patient. If restraints are required, use the minimum force necessary and assess the airway and circulation frequently when the patient is restrained. Again, if you have questions, as always, please contact your instructor and bring your questions to class. Thank you.